Morning, everybody. Thank you, Dr. Sarthak, for having me as a part of your amazing course. Good to see at least half-packed hall, the first talk, in the morning. And I've been asked to speak about adhesive capsulitis, the role of arthroscopy. See, no matter whatever we're going to do, okay, literature clearly shows that lot of procedures, every surgeon has got his own way of treating a periarthritis or adhesive capsulitis, yet nothing seems to work. And that is what the literature shows. And whatever you do, okay, there is no robust results or supportive evidence for you to suggest that this is working or this is not. So we don't have a consensus yet. And as when I started the practice, every shoulder pathology is treated as periarthritis. That's how they come up, Anybody, trust me, even an orthopedic surgeon would do that. Not even, a general medicine or a physician or any other guy. Just even an orthopedic surgeon used to treat them as periarthritis. That's how it all started. And, but having said that, we need to understand what a periarthritis is. It's basically progressive adhesive capsulitis, where it's a progressive painful loss of shoulder movements, and which leads to globular loss of range of movements. And the reason why I mentioned that is we need to understand the history. It's been almost all a century since the periarthritis was described way back in 1872. And since, it's been a century, and yet we have not understood the pathology, or we have not understood what exactly is going on when it comes to the adhesive capsulitis. I tried to research a lot for this talk, and I'll tell you what, I have failed. And how I failed, I'll let you all know. So to understand what exactly the stages of adhesive capsulitis, stage 1, we all know, it basically mimics the stage of impingement. So there is a painful, but there is not much of a loss of movements. The patient has got full range of movements, but it will be painful. It will be basically like an impingement. And stage 2 would be the patient will have both loss of movements as well as pain. And stage 3 would be, there will be no pain, but there will be loss of movements alone. And stage 4 is a recovering phase, where the patient will have all the symptoms resolving slowly. And the duration, each phase doesn't have a fixed duration. And stage 1 can be from few weeks till few months, or stage 2 can be from few months to few years. We don't know. That is how the disease is basically. We don't have a basic the duration which the disease progresses into. And out of all the research, the understanding of the pathophysiology, the crux of it, all the research has put forward that basically there is combination of inflammation and capsular fibrosis, which leads to the contracture of the shoulder joint and thereby restricting the movements. This is what we understood. And it is often, associated with various comorbidities, predominantly type 1 or type 2 diabetes. Trust me, near about 33% of the patients who are diagnosed with periarthritis are diabetics. And their thyroid dysfunction as well. We all know about all this, isn't it? So moving on, what exactly is happening? Because we'll need to understand why, if arthroscopy is going to work, we will have to understand what we are treating and what is happening at the cellular level to understand if the arthroscopy is going to work or not. So basically, not just arthroscopy, any capsular distension procedures that we do for the periarthritis is at the level of capsule. So what are we going to do? We are going to distend the capsule. We are going to make sure that there is more movements. But we have to understand, that is the pathology which we are treating with. But what is the etiology? Why is the capsule going in for is what we are yet to understand. To understand that, we'll have to go to the cellular level. There is a lot of extracellular matrix damage, macrophages acting, and collagen being formed, which is leading into the capsular tightening. So I want to discuss about three more important capsular release procedures which we talk. One is manipulation under anesthesia, which is one amongst the most commonest ones which are being done. And trust me, there are about 14,000 patients in England who undergo this per year. So that's a huge number. And in India, we don't have the numbers though, but definitely we do a lot of manipulation under anesthesia for this. And arthroscopy capsular release is yet another procedure which we do for, but out of them, about 17% of the patients fail because we don't start the range of movements immediately. So that is a take-home point there. We need to start the movements immediately as soon as any procedure. If you're going to leave it, the patient is going to end up with more fibrosis and more restriction of movement again. So we need to start the movements immediately. That is what the literature says. And there is yet another capsular release procedure, which is a hydrodilatation. So hydrodilatation is basically injecting more saline with few other injections into the shoulder joint, thereby distending. And even that, the research doesn't give us more evidence showing whether it will work or not. So there are, all these literatures which either have very less amount of information in them, or or the results are not good, or the sample sizes. So I've been researching all this, and eventually we found only one systematic review, which is done by Mond et al. And out of that, he had a good RCT which he had compared between mobilization under anesthesia with exercises alone at home. So out of that, none of them were all RCTs and not worth mentioning. So as I mentioned, this important slide does make a big difference for understanding when to start the movements. And for us to understand the role of arthroscopy, we need to work at the cellular level. Trust me, there are no papers at all which are working at the cellular level to show what is happening. And to summarize, we need to treat the pathology but not the etiology. Though the patients are relieved, okay, we are still yet to understand and when to intervene, and we should have to immediately start the range of movements. And thank you.